y'all. Kayla Mowdy, Doctor of Physical Therapy here with another Monday educational moment. So today I'm going to talk about tennis elbow. So tennis elbow is a tendonitis or tendinosis is actually what we call it, a hardening of the tendons from years of using them. All of the finger movement or most of the finger movement is actually controlled by muscles up here in the forearm. So those muscles all come to a point pretty close right here on this, what we call lateral epicondyle. So tennis elbow is also called lateral epicondylgia or lateral epicondylitis, which just means pain there or irritation there. So a few treatments that we recommend, you can actually have a counterforce brace is what it's called. It's just that little strap right here. It actually spreads out the force so that it's not all going to a single point right here. Another thing that we do is definitely release trigger points in this area. A lot of times when we're using our hands a lot of repetitive motions, twisting, turning, all that can irritate this right here. So a few things I'll go ahead and teach you. Counterforce brace, stretching. So stretching for this area, since it does include the finger flexors or finger extensors, you have to have your fingers flexed and then down, straighten out. So that should feel it pulling right through there. It should be comfortable. It should not be painful. Don't pull so hard that it hurts. Another thing that you can do that can keep the hand and wrist mobile and comfortable is this stretch here. That actually stretches these that attach at the medial epicondyle, which is actually called golfer's elbow. But if you're having pain in here, that could be something that could help you. We use a lot of manual therapy in this area, a lot of elbow joint mobilization, a lot of making sure that the muscles that help the finger flexors that are actually in the hand are strong and coordinated with each other. And then we can also use taping techniques or ultrasound to break up ultrasound sometimes with some anti-inflammatory stuff. If it's a new problem and we know it is inflamed, we can use that to calm down those tendons. But mostly what we know helps the most is the manual therapy. And fortunately for you, the elbow is pretty easy to get to, so you can work on releasing those trigger points on your own. If you're still having problems after you give it a good old try at home for a couple of weeks, come see me. Happy Monday. Bye.